The broadcast is now starting. All attendees are in listen-only mode.
Okay, good morning, everybody.
Good morning.
This is Michelle Leacock.
And Jessica Leopard.
And let's see, we've got about 7 attendees here currently. We're expecting 10, but hopefully they will join in. We don't want to keep everybody holding because we know you have things to do. These have been lasting about 30 minutes. If you have any questions, feel free to type them in. You are all muted, of course. But type in the questions. We will check them toward the end and answer them to the best of our ability at that point. From a standpoint of technology, sometimes things happen. Sometimes you may drop off. The whole thing may implode. Who knows what could happen. But if you try and log back in and we're not there, just give us a minute. We're going to get it reset up and then have you all log back in again, and then we'll get started from where we dropped off. We've had that happen once or twice in the years that I've been here, so I like to prepare everybody for that. You should have received your guides yesterday. If not yesterday, then certainly today. They will also be posted online. That has all the information you need to know about the 2018 benefits. So with that, let's go ahead and get started.
All right, open enrollment will begin October 16th, next Monday, through November the 3rd. At this time, you can make changes online by enrolling or logging into ADP. Be sure you print a copy of your enrollment confirmation sheet. This is the time you'll be able to add new dependents. Be sure you submit dependent documentation to us in HR by November 3rd if you are adding any newly dependents. Also, you can make changes to your beneficiaries for your basic life, voluntary life, and ADP and your 401k on the Milliman benefit website.
Okay, always a good time to take a look at those beneficiaries, and always print a copy of your enrollment confirmation. You know, you all work in healthcare. You know, if it's not documented, it didn't happen. Same thing with benefits. We have to follow our plan rules. So if you're saying, oh, well, no, I enrolled for me and my family, you know, and you've got the printout saying that you did or showing that you did, but something happened in the computer, then we can easily add them on. Whereas if you're telling us something and we don't have anything to show us otherwise, you know, you're kind of out of luck that year. So it's always good to have documentation. Did I pass that on?
Okay. Changes for 2018. We have new limits for FSA, HSA, 401k. We have a new vendor called Teladoc. We have premiums, slightly increase in premiums for medical and dental. We have limits for medical deductible and voluntary life. And we have it effective 1/1/2018. Woohoo, Michelle.
That's been wrong on a few previous webinars, so I finally got it changed. Yeah, it's hidden. So please note that this will be a passive enrollment. That means that everything that you have is going to carry over to 2018 unless you make changes, unless you add something or remove something. The only thing that will not is the FSA. If you want a limited scope FSA or if you want dependent care FSA, then you're going to have to go into the system and elect it. Otherwise, it's not going to carry over and you won't have anything for next year.
Who's eligible for the benefits? All regular full-time and part-time employees working an average of 30 hours or more per week are eligible for the benefits. If you elect coverage for yourself or your dependents, if you elect coverage, your dependents are also eligible for medical, dental, vision, and life insurance coverage.
Okay, and I do want to note that only your legal spouse can be covered on our plan. I know sometimes it's like, well, I've lived with him for 10 years. We're common law married. You know, we've got this, you know, state document. If it's not a marriage certificate, then they're not coverable under our plan.
If you are going to add your spouse or your children up to the age of 26, we do require marriage license for your spouse, birth certificate for your child or your dependent children. If it's going to be court order, we do require the court order indicating that you are required to maintain health coverage for your dependent.
Yeah, those would be for if you're divorced or something like that, or if you've got legal guardianship, then we would need the court order for that.
Yes. And this, don't forget, this is due by November the 3rd. If you fail to make any changes during the open enrollment time frame, the next event for changes will be outside of I can't even speak this morning. It's too early. Outside of an annual open enrollment, you may make a change if you have a qualifying event, and this change is the change is due within 30 days of the experiencing qualifying event.
So basically, if you don't make the change now, the only time, with the exception of the HSA account, that you can make changes to your coverage is with one of these IRS qualifying events. You have 30 days from that qualifying event to make the changes to your benefits. So you've got to notify us, provide the documentation of that event, and then we can make the changes.
As most of y'all know, we have completed the Wellness Incentive for 2018. That was completed on September 15th. You can log into ADP, go to your personal profile. There's a custom field. On the lower left side, you can see if you met both the health assessment and the biometric screening. If you are a tobacco user, you will have to complete the tobacco affidavit by November the 3rd.
Okay, and that will be in the enrollment. If you're still a non-tobacco user, then that'll carry over to next year. If you are a tobacco user and are still a tobacco user, you don't make any changes, then you need to complete the online Viveri course starting January 1st, and you need to complete it no later than February 28th. It is a true 4-week course, which means that you can only complete one portion each week. So if you get all gung-ho when you start January 1st, Viveri does reset you. If you don't log in for the next 30 days and you think, okay, well, I'll just do week 2 and on February 1st, it will reset you after a period of time and set you back to the beginning. So don't wait too long, prompt yourself on your calendars, etc.
All right.
Okay, so choosing the right healthcare setting, you probably recognize this because we've sent it out in email. I think it was in our last benefit guide. The thing that we are adding for 2018 is Teledoc. Excited to offer this. It is one of those services where if you haven't experienced it before, you use your phone or your tablet or your computer to have a visit for a minor health issue. Obviously, if you have a broken arm, this is not the way to do it. They're not going to be able to help you. But you can just go online and you set up either an appointment or you say, I just want to be seen as soon as possible. You can do it from the comfort of your home, or if you came in with a sinus infection, you don't have fever or anything like that, you borrow an office to have that 15-minute appointment, then you can even have it from the office. You don't even have to leave. There's a $45 cost, which is cheaper than any retail clinic, generally urgent care, walk-in center, or even your doctor's office for those minor type of visits. So even for you and your children, your spouse, if you cover them, can use the Teledoc service. The other thing that I wanted to mention is the freestanding emergency rooms. We just want to keep reminding you all that from a financial standpoint, for both you and the plan, not the best place to go unless that is your only option. Obviously, if that is your only option, then that is what it is. You go where you can get care. But if you have the opportunity between the freestanding emergency room and the hospital-connected emergency room, go to the hospital-connected emergency room, as the freestanding tend to cost about 10 times more on average. They're ridiculously priced. I guess it's because they've got a lot of overhead because they're standing alone. They don't have anything else to cover it. But you want to stay away from those for your financial health standpoint. So wanted to talk about claims because this is going to lead into some of our changes for this year. Unfortunately, in the stock market, they say what goes up must come down. housing, whatever. With healthcare, it's just up, up, up. 2015 was an anomaly for us. Healthcare costs over the history of healthcare have trended 5% inflation every year. You can see for us between 2016 and our expected 2017, those numbers are trended through August and then annualized. We're at about $4.3 million expected for 2017, which is a far cry above where we were in 2016. So we're looking at least a 13% increase for this year alone in our healthcare costs. So we are using the plan more, and the costs are going up. And so for that reason, we will move on to this slide where I can show you that the cost per employee per month is also trending upward, obviously. From 2016, our per employee per month cost was $1,000, basically $50. 2017 expected at the end will be $1,100. 2018, you can only guess from there. What I did want to point out, though, is that the employee share of that $1,100 2017 cost is nominal. It's about 10%. From I guess, overall perspective in the United States, employers tend to pay about 60 or 70%. Employees pay about 30 to 40%. So we do cover a lot of the cost of this plan. I wanted to point that out, that it's a 90-10 share for this. So this leads us into our first change. So the first change is that we are returning to deductible levels that were had here about 2008, 2009. We will be having a $3,000 individual deductible, $6,000 for family. Out of network, $4,500 individual deductible, $8,500 for family. These are going up because we didn't want to fully just raise premiums, because there are people who don't use the plan. They don't ever meet their deductible. So it's a combination of raising the premium slightly and raising the deductible slightly. So those that use it and use it to the deductible level will pay more next year. As a reminder, you always save more money when you stay in network, because it's 0% after you meet that deductible. Preventative care is always covered at 100% as long as your things stay in network, including your labs. Emergency room services, as long as it's a true emergency, it's covered at 100% after your deductible. But again, it has to be a true emergency. Don't walk in there with a migraine or something like that, because they're not going to consider that a true medical emergency when you're out of network. But out of network, you continue to pay 20% even after you meet your deductible. So it is something that you want to pay attention to when you're looking for care. Because when you hold down your costs and therefore the plan costs, you also hold down, help hold down your future costs. And so that's what we all need to think about. So medical benefit premiums, as I alluded to, they are going to be going up slightly. I wanted to put that in perspective because I know that everybody goes, oh my gosh, they're raising them again. From the National Benefit Survey through Kaiser, we're very competitive from a large company standpoint. We're below that $41 for employee-only coverage. Employee plus family nationally trends at $164. They didn't have information on the other levels, so it's not there. We also have some DFW information there. I'm not going to mention who the large hospital systems are. I won't name names. You could probably guess who they are. You'll notice that we are very well below even their costs there. One only has a PPO plan available, which somebody may go, yay, but the cost of that, are huge. $672.66 to cover a family is a lot of money. Mm-hmm. It's $4,000 individual deductible and $12,000 for family, even on the PPO plan. Then you've got your mid-size hospital system, which again, we're very competitive, and National Medical Device Company. If they offered wellness, a deduction off of their medical premium, then that also is included. So we're comparing apples to apples as best we can. So, sorry, I'm gonna go back here for just a second. All in all, now is the time to look at your coverage options. If you have, your spouse has options, with their company, now's the time to look at those and to make the best decision for you and your family. You are not tied to our plan. We offer it because we want to offer our employees and their families coverage. I know sometimes I've seen people go, well, I know he has coverage here and it's less expensive for him over here and here, but we want to be together on the same plan. Togetherness does not go with medical plans. You've got to do what's best for your family. For example, if you're eligible for Medicare, a lot of times that tends to be a lot cheaper than these outside plans. You really need to look at all of your options and examine them before making decisions. Once we get to November 3rd, you're locked in, unless you have one of those qualifying events that we talked about before. But you really want to make the best decision for you and your family, and so now's the time to really look at those and know, is this the best decision?
Okay, we'll talk about prescriptions. We didn't have any changes to prescriptions. It's still through CVS Caremark. You still have to meet the deductible. Actually, before the deductible is met, you're at a contracted rate for a 30-day supply. After the deductible is met, you pay a zero for in-network pharmacies. You do have the option to do a 90-day mail order.
And you can do the mail order at CVS pharmacies, or you can actually do the actual mailing. Up to you.
It is mandatory that you start with a generic prescription drug before moving on to a brand name. If you choose to go and forego the prior authorization for a specialty drug, you will pay a penalty. It's going to be the cost between the generic and the brand name you're going to have to pay, and this will not go towards your deductible.
So what this means is that if you or your doctor say, nope, they want the brand name drug, we're not doing anything, haven't even tried the generic, or you don't want to go through the prior authorization process with CVS Caremark, there is a cost. So let's say the generic costs you $10 and the preferred costs you $100. So you've got a $90 difference there. It's called a dispenses written penalty. So that $90 extra, you will be responsible for paying, and it will not go toward your deductible. If you go through the prior authorization process where, your physician shows that, yeah, we've tried this generic and it didn't work, it caused a rash or whatever it may be, and so CVS Caremark approves that through the prior authorization process, then the brand name, the total cost goes towards your deductible. It's only when you choose either not to go through the prior authorization process, or you say, you know what, I'm not doing the generic, I want this brand name. I see all sorts of things on it about TV and how awesome it is. Then the difference will not go towards your deductible.
Yes.
Hope that makes sense.
All right, HSA, health savings account. There was an increase for individual, family. If you're age of 55 or older, you're able to do the catch-up of $1,000.
And that does take into account our $300 company contribution. We give to you $12.50 every pay period toward your HSA account. That's obviously only if you have an HSA account. There are some people, either for religious reasons or personal reasons, say, I don't want the HSA account. Obviously, then they don't get the $12.50.
All right. New cards will be mailed out for those who are newly enrolled. So if you're going to elect HSA for the first time, you'll get a new card. Those who are going to carry over from 2017 to 2018, you can still use the same card if you're an existing HSA holder. It does not expire. Reimbursement is going to still be the same. There's no changes to HSA.
Still with Optum Financial.
Yes. Okay, limited purpose FSA for dental and vision only. You will have to elect FSA for 2018. If you are using it for 2017, you will have to re-enroll for 2018. The contribution is you use it or lose it, so be sure you plan accordingly to your.
You don't want to overestimate on
Right.
this one. Don't go, well, I'm going to have LASIK surgery and then never go get LASIK surgery. Funds are available day one, and there are different reimbursement options with this one. You've got the debit card, or the Benny card is what they call it. There is a small, I think it's $1.50 fee per month that comes out of your balance. There's the auto draft, which is basically just looking at your dental costs because it's connected to UMR. They're able to look at those and go, okay, you spent $100 on this, and so you didn't get reimbursed for that through the debit card. We're going to go ahead and send it to you. Or you can always do paper, where you submit your receipts and submit the form, and then they mail you a check.
Yes. There's no changes to your dependent care FSA. This is your annual contributions stay the same, $5,000 per year. This is for the children must be under age 13 or any dependent who's physically or mentally unable to care for themselves.
Okay, and this is the same, paper or the Benny card if they have the special software at the daycare. Obviously, if you've got a lady taking care of them, you can't use the Benny card with her. It's not like you can pay it through PayPal. It requires special software for that.
And your funds are available as you contribute each pay period. All right, dental plan. We had a slight increase in our dental premiums from 50 cents to $1, depending on the tier coverage you have elected. You still have the $50 deductible for individual, $150 for family. Your preventative services are still at 100% for cleaning, x-rays, and oral exams. Your basic services for oral surgery, extractions, and fillings is 50% after you've met your deductible. Major services is still 50%, for crowns, dentures, and bridge work, 50% after your coinsurance. Orthodontists, 50% coinsurance.
Yeah.
And it's up to the children of the age of 19. There's an annual maximum benefit, $1,500 per person per calendar year. And there's a maximum lifetime orthodontia benefit per child of $1,500 per year.
So our dental plan runs over $80 per employee per month. So again, we carry a lot of the cost of that.
There's no changes to our vision. We're still with Davis Vision. Premiums will still remain the same. Your co-pays, everything remained the same with Vision for this year.
So just one thing to note, you can only replace the glass lenses or the contact lenses in the same plan year. So 1 year, if you wear glasses and contacts, you just have to alternate off between the years. If you replaced contacts last year, or this year rather, do your glass lenses next year, and so forth, so on. Okay, life and disability benefits. So survivor benefits, AKA life insurance. We do provide to you $30,000 of basic life and accidental death and dismemberment coverage that's paid by the company. Voluntary employee life, you can choose 1, 2, 3, or now 4 times your annual salary, up to $400,000. When you elect voluntary life, you can also cover your dependents or provide a small life insurance policy for them. Spouses, it's $5,000. Children up to age 26 is $2,000. If you are adding or increasing more than a level on the employee life, then you're going to have to provide what we call EOI, or evidence of insurability. It's basically an insurance application to show that you are eligible for coverage, you're not unhealthy, about to die, anything like that. Same things that any other life insurance company would look at. Short-term disability, this is the one thing that I really encourage everybody to take advantage of. Sometimes people, what they call nickel and dime their PTO, they run it to 0, they get 8 hours, they use it. So if something happens, they get into a car accident, they get sick, they have to go on FMLA, there's no income for them at that point unless they have something like short-term disability. So it's always important, if your family or yourself, you cannot survive without your income, this is something that you want to consider. If you did not have it this year, you want to elect it for next year, same evidence of insurability applies. You've got to fill out that application. So you pay 100%. It pays you 60% of your weekly income up to a maximum of $1,250. The waiting period is 14 days. Benefit duration is up, they pay up to 11 weeks. Important thing to note is pre-existing limitations. If you've been treated for it 3 months prior to the effective date, the claims will not be paid for the next 6 months. So, for example, if you found out you were pregnant in September and you are due in May, they're not going to pay when you have that baby. The reason being is because that was what they call a pre-existing condition. So long-term disability kind of works the same way. The employee pays 100%, they pay 60%. This is on a monthly cost return to you, up to $5,000. It's the elimination period or the waiting period is 90 days. So while short-term disability pays, long-term disability does not pay. Long-term disability kicks in at the 90th day. Pays up to age 65 or could be a little bit later depending upon at what age you became disabled. The pre-existing limitation on this one is if you're treated for it 6 months prior to the effective date, submitted claims will not be paid for the next 12 months following that. Again, if you didn't enroll in it for 2017, but you want it in 2018, then you need to fill out the evidence of insurability form and turn it into Prudential. So retirement, something that everybody puts off but always looks forward to. So we cover and allow full-time, part-time 1, and part-time 2 employees to participate in our 401k plan as long as they're age 21, which most of us are. I look back to 21 with, I could go back there. So you have to satisfy a waiting period. So it's the first of the month following 30 days of employment. The company matches 25 cents for every dollar that you put in up to the first 6.85%. It's an odd number, I know. But the moral of the story is if you're not putting in at least 7% of your income into the 401k, then you're missing out on a 25% return on your money right then and there. You don't get any other return like that anyplace else. Safe harbor contribution, we do contribute 3% of your salary for eligible employees along with discretionary profit sharing. For those 2 items, you become eligible the quarter following after you've been employed with us for a year. You are fully vested at 6 years, and so vested means that if you work for us for 7 years and you decide to move on to some place else, then you take all of the money that the company contributed to your 401k plan at that time. If you leave before the 6 years is up, then you only take a portion of it. So you can contribute on a pre-tax or post-tax basis. Pre-tax means that that contribution comes out before taxes comes out. You will be taxed on it when you go to take the distribution when you retire. Post-tax, or AKA Roth, means that you are taxed on it now and you won't be taxed on it later. You can contribute up to $18,500 to your 401k every year. And you can do a catch-up contribution of $6,000 if you are over the age of 50. So how to invest, one of those things that a lot of people just, either guess at or don't know. We do have InvestMap, which is by age. It's basically a custom designed portfolio just based on your age. So your age group has its own portfolio. If you're younger, it'll be more conservative, or more aggressive rather. If you're older, it's going to be more conservative. You won't see quite the ups and downs that the younger group would see because they've got a longer amount of time to wait with that money. More time to watch it go up, which historically it does. So InvestMap is a good option if you don't know what to do. Custom investment portfolios, just that. You choose where to put your money. If you want 100% of your eggs in one basket, which I do not advise, you can do it. That is up to you. And then there's Morningstar. There's 2 options with that. The first one is you take a quiz. It tells you basically how risk averse you are and what they think you should invest in. The other is actually managed by Morningstar, where you pay a small nominal fee. I think it's 0.0048%. And they will manage it for you and move things around on a quarterly basis. Well, this is just one of those slides to remind us how little really we've all saved. It's always good to save now, let it sit in there, let it grow. I'm sure that there are some boomer seniors and even Gen Xers at this point that, if you're sitting next to a millennial during this webinar, or you have a millennial that you're close to, really encourage them to save for retirement now. If you're not familiar with the power of compound interest, I really advise you to go out and do some web searches on that in your spare time. I know it doesn't sound like fun. Maybe on a boring Saturday night or something. But compound interest really does work in your favor. It means that, you gain interest even on the interest, and as that grows, it grows to be a huge amount of money. So the earlier you start, the better off you are. Holidays, on to the happy stuff. So 8 holidays next year. They all fall on a weekday, so they will all be recognized on a weekday. So for 2018, we will have off Monday, which is New Year's Day, so that'll be a 3-day weekend. Thanksgiving is always a 4-day weekend, and even with the way that Christmas falls, for 2018, it'll be another 4-day weekend. So yay! Just a note for 2019, we have already asked the board about the January 1st, because it does fall on a Tuesday. We will only have Tuesday off in 2019. I just wanted to mention that because there's been a lot of confusion when the holidays fall on a Tuesday, like maybe we'd get an extra day off or something like that. That is not the case at this point. So in 2019, if you want the 4-day weekend, you're going to have to ask PTO off for that day. They may not approve it for a while because it is a ways away.
Yeah. All right, our checklist. So enroll and make changes by November 3rd. Submit application forms and new dependent documentation to HR by November 3rd. Complete your evidence of insurability or EOIs for any newly added short-term disability, long-term disability, voluntary life, and this is including your request to increase your coverage for voluntary life as well. Thinking ahead.
So 2019, the wellness deadline is the same as it always has been.
Yes.
September 15th, 2018. You may think, we just made it just 2017. Why are we even talking about this? We don't like anybody to miss out on, the money that comes along with our wellness incentive. It's a huge amount. For 2018, it's still the $1,200. Obviously, never any guarantees for any other years, but you want to get ahead on your biometric screening and get it done. A lot of times you'll call for your screening, your preventative exam, and your physician office will say, well, it hasn't been 366 days since we've seen you. As long as it's a new calendar year or a different calendar year than the time that you had your last screening, you can have another one. We do not go by the 365-day rule. They think that in their head, but what you need to do is push back on them and tell them, no, you need to call UMR and, confirm it with them, but this is the way that it goes. If you have issues, then have them give Jessica or I a call, but that is not the case. There is no reason not to get this done early in that case, other than just, I guess, general procrastination. And just as a note, I know that this has happened at some clinics where our physicians have done screenings for our staff because they've waited. We are not going to allow that for 2018. So you need to plan ahead. You need to see your primary care provider for the biometric screening. It is 100% paid, so there's no reason not to go to your primary care provider to do it. The challenge with having our doctors do it is, first of all, it takes up their time. Secondly, if you're seeing them, you have to be one of our patients. If you're not one of our patients, then you need to go see your primary care provider. There's also liability in them for that. If there was something that, was on your labs and they didn't share it with your doctor or something to that effect, or they missed it, they didn't mention it, they just signed off on it because they were trying to help you out, there's liability in them for that. And also a lot of times the bill goes to the company instead of to the health plan. and then we have to chase you down to pay it. You know, in the end, the goal is health and wellness. Primary care providers see you or should see you on an annual basis. It is 100% covered, no reason not to go. But, you know, they're the ones that should be keeping track of your health and not, you know, oh, I need you, Dr. blah, blah, to do this for me. You know, the goal in the end of our plan is wellness, not to just get it done so you can save $1,200.
If you're a tobacco user, don't forget to complete your tobacco course by February 28th, 2018, or you will lose your 2018 wellness incentive.
So don't forget that one. So enrollment again, October 16th through November the 3rd. Jessica will be visiting the clinics to help with enrollment. Again, you can always call with questions. I don't see that any questions have been asked, so either we've done a really good job, you've all tuned out, or you guys are really smart. So for that, we thank you. Thank you for joining us today.
Thank you.
And again, if you have questions, let us know.